Yes.
Hi,
Hello, Andrea. How are you?
better.
That's good. It's good to see everybody again. I was on vacation last week. It was much needed. So happy to get back. We have a full
Where
house.
do you go? Oh,
I
wow.
went back to see my mom. She lives in Texas, so about an hour north of Austin. We went to SeaWorld and didn't get much rest, but my kids had a good time, so we just got to hang out and do a bunch of stuff.
Oh, that sounds nice. I'm glad you enjoyed.
Thank you. Yeah, it was great. All right, I got like three more pending to come in, then we'll get started. We have a big turnout today. Yeah. All right, so we have, oh, hold on, more. Let me enlarge this. It'll take my full screen today. Okay. Well, I want to thank everybody for hopping on. Oh, one more. Our hormone happy hour. And you have all of the coaching team with Davey Mark Fitness here. We also have Lisa, our health advisor. We usually spend a couple minutes at the beginning, seeing if anybody has any questions or uh, any current clients have anything for us as a collective. I guess I'd like to start there, and I'll give everybody just a second. I know I still have some people joining in. Yes, Lisa.
Something I'm running into a little bit are some clients that have been diagnosed with Lyme's, colitis, things like that, that are kind of going a little bit hand in hand. And I want to be able to point them in the right direction as far as confirmation of what we would be able to do and how we would be able to help them. I know Lyme's is tricky, especially if you've had it for a long time and it ends up affecting your organs. So I don't know if you have any insight on that.
Yeah, absolutely. So I think looking at like Lyme, uh, kind of fit RA, lupus, you can see Epstein-Barr, all of those things kind of meshing together and having a hard time figuring out what's going on. One of the big things with all of those is going to be just systemic inflammation. So I think about potentially working on that maybe from a nutritional, lifestyle, supplementation standpoint, and then even into pharmaceutical standpoint. So I think there's a lot of layers that could be worked on there. Other things that I've just seen with Lyme, I live in Arkansas and we actually have a lot of Lyme here. So I have a couple clients that I work with here locally. Um, Underactive mitochondria function, so cells just become less efficient at moving and doing stuff. If that's clearing out toxins, if that is extracting things like B vitamins. So I really think about supporting mitochondria. I also think heavily about thyroid function. Thyroid function tends to downregulate with autoimmunity. I think it's case by case, most definitely. So you really want to get a clear picture of what's going on with that individual and seeing what areas are impacted. We had a client come in here several months ago and she had Lyme and had a lot of neuroinflammation and just other sorts of inflammatory issues. So kind of figuring out origin there and kind of working backwards. When I think of things maybe from a pharmaceutical standpoint, peptides are really cool. Um, some of the thymic peptides seem to be very helpful. So your chest has a thymic gland in it. All of us do. As we age, that thing starts to not regulate T cells as well. So using some sort of thymic peptide, maybe low dose naltrexone, maybe some mitochondria supporting peptides are things from a pharmaceutical standpoint. But I really think that you probably want to step back and look at like those baseline layers. Um, I'd be curious if I know I seen Ashley on here, if her thoughts on Lyme and potentially if she's seen anything from like a GI standpoint, and then maybe kick it over to Charlotte and talk to her a little bit about that. But those would be kind of my recommendations. I think starting uh, low, low hanging fruit, and then kind of working your way up.
Yeah, well, I would say initially I agree with everything. I mean, I think it's just like big system kind of maybe overload basically with a lot of those. I first think in terms of like just immune function and inflammation, which 100% disrupts the gut lining. I mean, inflammation in general, and like 80% of your immune function comes from your gut for the most part anyway. And it's just, I mean, stress can disrupt your gut lining. And so obviously these are like more systemic stressors across the body in general. So, I like knowledge. So when I have somebody come in, it's like what testing has been done and what testing can we do to get like the biggest picture of everything that's going on internally. So, and I like in general, I like a GI map on every single person anyway, because I feel like it gives such good insight. But that's what, when someone has a lot of different systems involved and a lot going on, I'm like, okay, what can we see? In terms of what directly can we start addressing while working on the overall inflammation. And I think that's a good place to start. We've talked about that a lot just through the time of just can we start repairing that while you're also looking from the outside, like what is lifestyle, what is your stress, how are we reducing overall inflammation? So yeah, I would say just gut wise the biggest thing is just inflammation and that how it's impacting the lining, that permeability, the immune system of the gut for sure. How like cytokines might be influencing that and making that different. What is gut health like across the board? More likely, especially with Lyme, to get things like opportunistic microbes or candida and stuff like that, especially if they've taken antibiotics for any of this, just because that can obviously disrupt the microbiome. The other thing I think about is like motility. Again, depending on what's going on, like how motility is impacted, how nervous system is impacted, which can impact that motility. Yeah, and then I think going from there, I just look at like the whole system in terms of like just stress factors, and then supporting, like you said, like with supplementation to look at some of the different things like a lot of times with Lyme, you get a lot, I mean, obviously a lot of different systems, but like brain fog and, digestion impacted, fatigue is impacted. And so how can you support some of those things while working on the root? But I think there's lots of supplementation that can help with those depending on what specifically they're dealing with.
Thank you. Um, Thinking about like Lyme, there's a doctor, his name's Dr. Ken Holtorf. He is one of the, I don't know if he's a founder, but he speaks at a advanced certification. Hold on, I'm going to mute everybody.
Guess they like the expensive stuff. Take care of it.
Okay. So when we look at Ken Holtor's stuff, he actually had Lyme. He has like a foundation for hypothyroid. I actually have a really in-depth, and I'm not going to do a whole presentation, not to bore everybody, but I like to show this. This is several years ago. I worked for a telemedicine company, and they actually paid to fly me out to uh, watch some of his teachings. And this is actually about Lyme. I think this one's a little bit older. This is from 2009. So innovative alternative therapies to chronic Lyme disease, because there's just so many different options. This is like kind of something I've read over, and I agree with a lot of the things and kind of talking about multifactorial systems. He has a slide in here. One, immune system. So uh, I always talk about if anybody's ever consulted with me and talked about immune function, it's almost the seesaw of regulating your Treg cells. And a lot of times with Lyme or other sort of autoimmune disorders, we have a shift where the innate immune system will become overreactive. And the body starts to attack tissue, attack itself, promote inflammation. So being able to regulate Th1 and Th2, and it's a multi-system disease, just like what Ashley was saying. So some of the big things you see with Lyme, I mean, this is all the things that can impact Lyme. So triggered events, sleep disorders, genetic deposition, HPTA dysfunction, immune dysfunction, GI disorders, nutrient deficiencies, mitochondrial deficiencies, neurotoxins, environmental toxins. So it's usually like a point of origin. And then depending on that person's genetics or environmental toxins, it could shift into a whole bunch of different places when we look at Lyme. The one area that I say that tends to be true for most things is going to be the hormonal deficiencies because for women, the HPOA becomes disrupted. So we can see downregulations of sex hormones. I see a lot of thyroid disorder there. That is directly going to tie into mitochondrial dysfunction. So it's a cellular based issue. I see a lot of brain fog, chronic fatigue with that. So um, there are lots of therapies. So he goes through some of the things that I see probably most helpful. And if anybody's interested, I can send this low-dose naltrexone, thymosin alpha-1, thymosin beta-4, BPC-157, chelation therapy. I see those to be very helpful. Things like glutathione. Um, what else was coming to my mind? And then mitochondria support, and it just depends on the severity of the chronic fatigue. So somebody may not do well on a methylene blue or some NAD. There's a lot of other smaller playing things with mitochondria function that may be less overwhelming. So mitochondria is a phospholipid, it's a fat layer. A lot of times that integrity starts to break up. So some of those peptides go in and actually regulate just the integrity of that cell. So it is able to do its job. So um, those are things that I would think at. I know I can't give you a straight answer for that, Lisa. If you want this, I can send it to you. It's long, but it's got lots of adjunct treatments in here. And I've seen a lot of these therapies actually play out with people. It is very helpful. I can actually drop it in our Slack channel and everybody can just look at it.
That would be great. I really appreciate it. I have a potential client and she has tried low LDN and some other things and she couldn't systemically, she couldn't handle it. And so there's like she's kind of at her wit's end. So I'm just seeing the best way we can moving forward, try to, you know, get her in the program and help her out. So
Yeah, and I would say if you're having a lot of adverse reactions to peptides and LDN, you probably have some detox issues you need to work through, and that would be Charlotte's forte. I would say like, hey, kick it over to her and let her kind of run through some of those things. But you can see on that diagram, environmental toxins is a big piece of that. So I would probably say some sort of detox or cleanse would make a lot of sense prior to trying to regulate immune system, especially if we're built up with a bunch of toxins. Charlotte, do you have any input on specific things that come to mind, maybe from a detox standpoint?
I think the hard thing with Lyme's, if you are really reactive, is just how you react to anything coming into your body. I think that's really challenging. So even for the detox kits that I use, it would almost have to be small doses of enzymes before even doing the detox itself, just to see how the body responded. When people are really, really, really inflamed, even the detox space becomes just minute, small trial and error. It can't be balls to the wall either, the more sensitive you are. So, yeah, it's kind of like handle with care, trying small little doses of this or that and seeing if you can handle it. I have seen in some forums a few people with Lyme's having good success with detoxing and others having a really hard time with detoxing. So again, it's just like, what is the layers of toxicity that someone's dealing with? Are they a poor detoxer? Do they not detox well? Do they have low enzymes? I forget what they're called, but so many factors coming in with these co-infections and different things. So it's little bites at a time. That's my best suggestion there.
I think we have one or two people in the program right now with Lyme. So, there are, I would say there's definitely a lot of things that individual could try, Lisa. I would have her reach out to some of the coaches and maybe we could talk through some of those things with her. Oh, got another one. Um, I was right as we were first starting. Andrea, if you're open to chat, you say that things are going really well. I'd love to. It's been a couple weeks, see how things are going, check in on some of the progress you're making.
Um, I mean, I have made progress and setbacks both. Um, like diet-wise, it has been going well, and I think I have a bit more energy as well. Possibly because of the testosterone, but it's very hard to tell because in between I had a severe appendicitis and a surgery, so I'm recovering fairly quickly, which is a good sign.
Yes. How many weeks has it been since your prescriber had given you that testosterone?
It's been about 6 weeks, but while I was in hospital, I stopped it, so it's not been ideal, so it's hard to tell now.
Gotcha. Well, yeah, I'm glad things are somewhat improving. I think with healing, it's two steps forward, one step back a lot of times, and then just continuing to repeat that process till you get to the
Mm.
point where you feel better.
But I also ordered the peptides that you recommended, and I'll send you an email if I need help with the
Okay.
preparation and how to use it. They're here now. I have them now.
Yeah, absolutely. We can definitely talk through that.
Hmm.
And yeah, I think like we talk a lot about peptides, and I see a lot of new faces here. So, like what are peptides? I think that's a common thing I hear quite a bit about. And, thinking about peptides, they're basically just short chains of amino acids. Those are building blocks for protein. They kind of uh, act like messengers in your body and telling your cells basically what to do. So I think of them like, I don't know, like it sounds funny, like biological text messages to get things to kind of move in a certain sequence. And that could be from, healing, hormone release, fat burning. There's even peptides around libido. So there's several different classifications, and peptides bind to receptors. They activate a certain response. So for example, you'll hear a lot of people talking about repair peptides. We talk about BPC quite a bit. The BPC-157 just basically creates increased blood supply to ligaments and tendons, which kind of tell your body to help rebuild that process. Some of you may be aware of Vyleesi, which is one of the melanocortin peptides that is given for um, what's the medical term? You basically have a low libido, and it's an injectable or an intranasal. So there's just so many different classifications of these drugs, and we see them gaining a lot of popularity in the space. So I think that when we look at it in the context of postmenopausal women, you potentially could look at things to help with fatigue, poor sleep, low libido, weight gain, brain fog, joint pain, slower healing. They're not long-term treatments. Really, they're just helpful to kind of nudge your body back into balance, whatever sector that you're working off of. So, I think that having more information around that and then having a clinic to be able to prescribe them because you can go online and buy all kinds of stuff. I usually don't recommend buying gray market or third party peptides. The bottle says not for human consumption, so you probably shouldn't be poking yourself with that all the time. I know for some people, based off of your country, you may not be able to have those compounded, and you have to do what's next available for you. But if you have the availability to do some of these pharmaceutically, I would recommend looking at that route of things. With that being said, does anybody have any questions in regards to certain peptides or any clients here open to talking about experiences with peptides? I think, doing a brief introduction and seeing if anybody has anything would be helpful from a group setting. That is no problem. Um, from the coaching side of things, Ashley, Lisa, Charlotte, Sophie, is there anything in particular? We keep names confidential, but I've been gone, past 7 days. Is there anything lingering or uh, anything that I can help with or we can help with from a team setting?
I have a client who he was supposed to be taking testosterone, but he had an issue like getting it. But now he's kind of like, I don't know if I want to take testosterone. So he wanted to look into different options, things that can help him boost his testosterone. He's already starting to see a lot of biofeedback improvements. So digestion's better, bloating's down, energy levels better. He's been lowering the amount that he's been drinking and everything. But then he also wanted to I think he couldn't make it on the call, but he wanted to know a little bit more about like either peptide. He's been also been taking the BPC-157, which has been helping him a lot. Think you know who I'm talking about.
Uh-huh.
And then also he just wanted to know if there's other things that he can take naturally that can help him out to help him boost his testosterone levels before he starts taking testosterone because he's not too sure about it.
Yeah, I understand, hesitancies around that. What I will tell you is like the male body, our testes are really lazy. So if we take testosterone out of a bottle, our body does not produce endogenous or internal testosterone. So taking testosterone from a bottle can definitely inhibit that process. There's different classifications of drugs. What we use, say we have somebody come in, male come into the clinic with like a testosterone of like 3 or 400. We don't give testosterone in that setting because fertility, there's so many other things that go into using testosterone. There's drugs like enclomiphene citrate, which is a selective estrogen receptor modulator. And what that drug does is it blocks the estrogen receptor in the brain and it causes your body to pulse more LH and FSH. So it creates more internal testosterone. That is an option. It's an oral pill. Based off of his response, that could be from 2 to 5 days a week, from 12 to 50 milligrams. I've seen really good success. So if somebody, say, is not taking care of themselves, and they start exercising and using something like that, you can get your natural production up pretty high, and then through lifestyle and dietary choices, be able to keep it elevated. So that's one option. The other drug,
What was that called? Or would you send him that?
I'll drop it for you here right now
Okay.
in Slack. Let me do that. Um, I can't multitask. I'm not good like that. So give me 1 sec so I don't forget. Okay. And the other one people are familiar with is 8-CG or Pregnol. And that's just synthetic LH. And that actually does a really good job of as well of increasing male testosterone. We use it more in like a fertility context, but it can be used as a solo therapy as well. And I see people having really good response from doing that. So um,
Being where he like where his head is at taking like at taking stuff and everything, which one would you recommend first?
Probably the enclomiphene is just for the ease of use. I think
Mm.
sometimes people can be hesitant to want to inject or um, the enclomiphene's pretty like low barrier of entry. You just have to swallow a pill a couple times a week and um, it should work pretty well. What I will tell you is some people already have elevations in LH and FSH, and using those drugs to increase that frequency may not be as helpful. I think that's more age dependent. In your 50s, 60s, and 70s, you're probably not going to get a lot of response. You already have a secondary hypogonadism happening at that point. But for somebody in their younger years, yeah, I think it can be quite helpful for sure.
Okay. Okay.
After he does something like that, vitamins, minerals, those things go a long ways. I think most of us are deficient in those. So I see a lot of low testosterone just because people don't have enough B's and zinc and D and selenium. And, I think those things really matter as well.
And he's also seeing like I think like even just with the couple of months that we've been working together, he's already starting to see like his strength is improving, his recovery is improving, and I know that all of those are signs of just like increasing in that. So
Yeah.
yeah.
Yeah, I think the big piece for hormonal dysfunction for anybody, male or female, it's usually a lot of metabolic processes and nutrient deficiencies that is causing those shifts in hormones. Yes, there is postmenopause, like you go through that and you won't have hormones, but in the years where you are menstruating, you start to have some changes in hormones. I'd say a lot of that could be environmental toxins, nutrient deficiencies, sedentary lifestyle.
Yeah. Okay.
So yeah, I
Great.
know exactly what you're talking about. You should give him both those options, and then he can reach out to a medical team, and they can kind of walk him through what that process would look like.
Okay. Awesome. Thank you so much, Justin.
Absolutely. Uh, oh,
I have another one if I have another question if you want.
yeah, absolutely.
Okay, so I know of a girl who went into menopause at 36, just naturally, I guess. So 36 years old, started BHRT around 4 years ago of just progesterone. Recently started some estrogen um, on a blend of T4 and T3 as well. And also eats clean, works out at least 5 days a week, strength training, not doing anything intensive, and is having a very hard time dropping the weight. Still not feeling great, still not waking up with a lot of energy, um, trying to do all the things, but things aren't budging. They're not moving in the right direction and just feels there's got to be some sort of missing link, but not quite sure what it is. And is working with a holistic hormone specialist from my local area.
Okay.
Um, but, just feels there's got to be some sort of missing link, gluten-free and dairy-free as well.
Yeah. Some of the things I think about, blood sugar management, hepatic glucose regulation, like testosterone does a lot for that. I know not everybody wants to use testosterone, but I also think you can't just discount it out of the conversation. So a lot of times what I see in men and in women with really low testosterone, we may start to see issues with hemoglobin A1C, insulin. We may see backed up liver function. So testosterone is going to support, the body's ability to utilize glucose. It's going to help with maintaining muscle mass, so we can uptake glucose. I think, most people undermine that aspect of it and they just think of it as a male hormone. The other piece with having adequate levels of testosterone is that stress resilience piece you really get from it. So it may help balance the adrenal glands as well. What I would say is looking at that individual's labs and then seeing like what potentially is high and low. I think it's great she's doing some thyroid medication if she needs it, the progesterone, the estradiol. But if you're already doing two of the three, it makes sense to kind of look at that testosterone piece. Um, and then adrenals. Adrenals are so tricky though, because they tie in with thyroid and gut and liver. But man, that is a whole other, avenue that I think if someone is chronically fatigued, you want to at least acknowledge those things. Has she had any like symptom relief since adding in the estradiol, or has it been, kind of low and slow this whole time?
She just had it increase recently, so I think it's been a low and slow if I were to say over the course of the 4 years, but like the estrogen was just added in not too long ago. So she's 43 now, but started this at 36, which
Yeah,
is which is crazy young. But yeah, I think maybe looking at that testosterone piece too, because the other thing is sometimes she feel like battles with a little bit of depression and doesn't know why, like just kind of has no reason and isn't quite exactly sure what that piece is. And it's not all the time, it's just here and there. So I don't know, maybe that is the one of the missing links.
yeah. I think that you know, I see that a lot in both male and female is maybe change in mood and some sort of like depressive symptoms kind of showing up. Um, I would say have her reach out to one of the coaches, send the labs. We'd love to look at them. I would look at them with her if she wanted to, just to get an idea of what's going on. Um, but I know personally, me having adequate levels of testosterone really stabilizes my mood. And I would assume, any of the ladies here are using it. As long as you're within a good range for yourself, it should stabilize your mood. If you're taking way too much, yeah, it could totally impact your mood and not make you feel well. I think there's uh, a Goldilocks zone with all of those hormones, and we're all different. So, figuring out what that is for that individual. But yeah, if she's there local with you, you should have her reach out and just connect with a couple of us and see how we could help her.
Okay. Yeah. And her husband takes testosterone too. And, the doctor said you need to be careful because I guess he wasn't doing an injection, and having it transfer.
Yeah,
Um, the other thing I've heard too is like it changing women's voices, like women who are singers. And then like, do they have to be really careful? Can they start low and slow if they need it, if they're having other issues or
yeah, I would say always start low and slow.
right.
My mom has been on testosterone 5 years. She's still very feminine, has a very feminine voice, but the dosing's very low on that. Where I think we see the extremes is like women taking a ton, or I see people get pellets and have like a three or
Right.
400 testosterone. They're like, oh, testosterone's not for me. I was like, well, it's not for any woman at that level. Like it's not gonna end up well for you. So yeah, I would say the thing is those change in vocal cords, hair loss, facial hair growth. Some of those characteristics can be, long term or non-reversible. So you really want to take your time and work your way up. Um, I've seen all kinds of crazy stuff before. I think we had a nurse practitioner here at 1 years ago who was self-prescribing testosterone, and her testosterone was through the roof. It was like 500, and she was having so much side effects with it. So it's a balancing act for sure.
I was gonna say Lisa, if she wants to talk to me personally, because I just started testosterone like 6 weeks ago, and we've been going very low and slow. We started out with well, we started out 5 units twice a week, then we actually backed off, and then recently we just upped it to 5 units twice a week. And my voice hasn't changed. I mean, I'm only in the beginning stages, but definitely noticing like I was having like insane mood swings, maybe some of the depressive feelings like she was having.
Mhm.
Definitely don't feel that way in the last, like, I would say 2 to 3 weeks, things have kind of turned around. So
That's
if
awesome.
she wants to talk to someone with, experience, you
Hmm.
can always send her my way.
I love that. Thank you
Cool.
so
Thank
much.
you.
Thank
Yeah.
Yeah, I think the thing is Also having some practical application. If you've done it yourself, like Lisa, then you can kind of speak to the unknowns for people. You know, I know for me being a male, it just may not always hit the same and resonate the same. So having somebody on the team who is using hormones, that's awesome.
Regarding testosterone, I'm here in Ireland, they only have the 50 milligram gel,
Uh-huh.
and I have to divide it into 10, which is really difficult. So I probably have a bit of a different amount every day. Um, I haven't had any side effects that I will know, but with all my other things, it's hard to tell. But I'm wondering how good or bad or how that is if you have a slightly different amount of testosterone every day.
Yeah, I think you could potentially change things like aromatase activity. So testosterone is a prohormone to estradiol. So sometimes you're going to get a large bolus of testosterone. You potentially could have more aromatase activity and more estrogen, or you could potentially have a more 5-alpha reductase into dihydrotestosterone. Really, when I look at like things where people have a lot of the hirsutism or virilization male characteristics from testosterone, it's usually a lot of other underlying things. So low sex hormone binding globulin tends to be a really big one. We see that with insulin resistance and PCOS. The binding proteins basically hold on to DHT. So they have like a binding affinity of like 3 to 5x. So if that binding protein is low, those DHT metabolites could be more problematic. Um, I think it depends on, how well your body's able to detox and metabolize estrogen from that opposite spectrum from aromatase, because I've seen some women not use any estradiol, maybe just use bioidentical testosterone and bloat up and have sore breast. So you really want to look at it from both aspects. And Andrew, you've been working on this for some time, so you may have some of those other underlying things improving and may not have
Mm-hmm.
as much negatives around it. But what I see a lot of times is people don't do anything for their physical and just want to take hormones. And they're like, oh, it was a nightmare for me. And I was like, well, your gut was a nightmare. You had a bunch of inflammation. You can't just take a pill or a shot and expect it to work better. So I think you uh, kind of working on those foundational pieces probably set you
Yeah,
up in a better position to use that stuff.
possibly, hopefully. I'll have in about 2 months it will be tested the level and then I'll know more.
Yeah, I would recommend when you test your testosterone, are you doing a once a day application?
Yeah,
Would not dose it before you go in. You want to see it about 24 hours metabolized, because if you put it on your skin, it's going to be high. So you want to see like
yeah.
where you are at your low
Okay.
point, because then they
Good
may
to
try
know.
to change your dosing. And that even matters for all the women here who are using bioidentical hormones. If your practitioner's not keeping up with your dosing schedule and having you come in and do labs on specific days, they're not really getting a good idea of where you are. I've worked with several medical providers, and their thoughts and stances around it is looking at the trough. So where you are at your lowest point will give you an idea if you potentially need more testosterone or if you're overdosing. But if you're taking an injection and then going to the doctor, or applying a cream or a gel and going to the doctor the morning of, you're going to have elevations in numbers. And that
Hmm.
may rain more like, or it may resonate more with people taking thyroid meds. If you take your thyroid meds the morning of the test, you're going to have a really low TSH. But if you get that 24-hour period in between, you can see if things are adequate at that stance. So I wouldn't go any longer than, 12 weeks without testing, though. You want to get in there and make sure
Hmm.
things aren't too high.
Yeah, and then another question, when would you test the hormones? I don't know whether you remember, I have quite high estrogen, low progesterone on day 21, and then very low testosterone. So What is it like between day 90 and 21? If I also want to know the progesterone, or what would be,
Yeah,
is that the best?
I would because
Also for testosterone or estrogen?
well, your testosterone is should be at a baseline because you're supplementing that.
Oh,
We
yeah, yeah.
want to see that luteal phase of progesterone, get an idea of where that is. And then your estrogen as well. So looking at your estradiol at that point, I would recommend for cycling women days 19 through 21. If you're
Mm-hmm.
fully in menopause, go in between your shots. Those are usually my recommendations. But your other hormones most definitely matter. And if you are using testosterone, you want to make sure those other two are well balanced.
Yeah,
But
thank you.
yeah, last thing I was going to say with that is I think that, even from an immune standpoint, having adequate levels of testosterone are going to be probably pretty beneficial for you. Not saying you need 1,000 reading of testosterone, but just a normal physiological number for a lady is going to help from even an immune standpoint.
Mm-hmm.
Do we have any other questions from the group? We have about 15 minutes here. We'd love to talk to you. My big points today, I wanted to talk about peptides and see if anybody else had anything that we can help y'all with.
Um, Maybe you recommended me two different peptides, the 157 and the thyroxine alpha.
Yeah, the
And would you take them at the same time or one after the other?
yeah, I would say depending on for you, because I know you and I've met with you several times, I would probably do it in a strategic fashion of BPC-157 is just more of an anti-inflammatory type of peptide. I see people having very, like, almost nobody has any negative side effects from that. And I would say almost most of the coaches here have had a client who've used it. With the thymosin alpha-1, I showed an image at the beginning on that Lyme slide of that TH1 and TH2. What thymosin alpha does is balance that seesaw. For some people with a lot of immune dysfunction, it could be a little overwhelming. So I would potentially start with the BPC, make sure that you have a good response to that. And then I would think about adding in that thymosin alpha, potentially at a lower dosing, and then working your way up on that dosing based off of your response. And the things I think about is if you feel like you're having more of a hit on immune function or brain fog or decreased of energy, you probably want to back off of that would be my recommendation.
Okay, yep.
But I think both of those work quite well. I know the TH1, the thymosin alpha, it's approved in different countries for post-COVID long haul, hepatitis B. You see it for a bunch of different stuff. So it has a lot of benefits. So I do think it would work well for you.
Yeah, I'm looking forward to trying it.
Well, if no one else has anything specific, I may wrap this one up a little bit early for us. Wanted to give everybody another chance, and if not, we can conclude our meeting here. All right. Well, I appreciate I think this is our biggest call. We had 22 people here today, so I appreciate you coming in and listening to us. We'll be on next week if anybody wants to talk with us. We'd love to do it. And yeah, I appreciate all the guests and the coaches joining. I hope everybody has a wonderful day.
Bye.
Thank you.
Bye.